Hi there, this is just my cast care video. So I'm just going to run through a few things about casts. So casts and splinters, they're there to support our bones and our soft tissues, hold the bones in place if they're out of place. They're there to reduce pain, swelling, muscle spasms. So first thing, when we're assessing someone, we want to check their C-temps, so that's their color, temperature, movement, pulse, and sensation of whatever extremity we're working on. We want to examine the skin for breakdown, bleeding, abrasions, odor, and then of course we want to check our patient's pain levels and if we need to address that and get some medication or whatever we need to do for that, or do some other non-pharmacological tactics. For teaching for our patient, we want them to remember that they need to keep that extremity above the heart level. That just helps with the circulation. And that the first 48 hours are critical to reduce their swelling in that extremity. So they need to stimulate their circulation by wiggling those toes and those fingers. So that will help. They can use ice intermittently, so no more than 10 minutes at a time to prevent skin damage. And that will help reduce swelling as well. They need to remember that they can never submerge their casts, especially like the plaster ones, in water. So if they do obviously need to have a shower, preferably not a bath, they need to tape up their cast really well and make sure it's waterproof, and that they need to be reminded that if their cast does get wet, it will have to be removed and replaced. So it's not a good situation to be in. We're also going to remind them that they shouldn't be using lotions or oils in their casts or splints, just because that can cause skin breakdown and just cause like moisture that shouldn't be there. So they can try moleskin instead, so that'll keep it dry, but it'll also create a buffer if they're having irritation from the cast or their skin. So the first thing I'm gonna touch on is the figure 8 tensor. So that's used for ankles and the wrists or knees, whatever. So that assists in the circulation and prevents blood flow constriction. So you want to start with a 2 to 4 inch tensor bandage, and when you're rolling it on, you're going to want to have the roll towards you to prevent it from slipping out of your hands, and you're going to want to apply it on a half of its stretch, so not full, not loose. You want it about halfway. So for example, if we're doing an ankle, you're going to want to start at the ball of your foot and then cross diagonally it down over the heel, overlapping and just continuing up the leg for however far you need. So those should be rewrapped every 4 to 6 hours, or if they become loose or too tight, you have to switch them up. So again, just watch for those circulation signs like blue toes, swelling, numbness in the fingers or the toes, or whatever you're working on. Just keep monitoring that on a regular basis. So next would be our triangle sling. So that's used for, our shoulder or arm support, whatever you're needing. So you're going to have your triangle, you're going to slide it under the injured arm. You're going to have the point under the elbow, and then you're going to bring the strap back across the neck of your patient. And then you're going, the other side. And then you're going to bring up the point at the end, and you're going to tie it right at the collarbone. You're going to adjust the sling on your patient so that the bandage goes right to the end of their little finger. So you want support along the whole arm, right up to the end. And again, watch for circulation. So the numbness, you can check their capillaries as well and see if they refill. It should be about 2 to 3 seconds. They should refill from blanch to skin color or red. So then next we can do we have a Zimmer splint. So that is for like post-op knee surgery, patella dislocation. So before we put it on, we want to double check our leg to begin with. So circulation, abrasions, any skin breakdown, and that's all before you apply it. So you want to do a good look. You want to make sure you're not putting it over the clothing, but just directly on the extremity itself. And you'll get your patient to elevate their leg either on a bed or a stool or wherever, so that it's nice and flat. And then you'll put the splint under their leg, and you want to line it up right so that the hole is going to be over the patella. And when you're doing up the straps, you want to do the ones above the knee and below the knee first, and then do the remaining straps after that, just so you make sure it's a really good fit. You can tell your patient you can be watching the splint with soap and water if they're allowed to take it off. If not, then they're just going to have to deal with the itch or the smell or whatever the problem is. But again, there's things you can do about that as well. Thank you.